most famous physical therapist on the internet.
Howdy, folks. I'm Bob Shaw, physical therapist.
Brad Heineck, physical
Because
therapist.
we're the most famous physical therapists on the internet.
In our opinion, of course.
Wow, that was almost musical, Brad.
Well, I'm working on it.
You're adding things to this show. Today, we're going to talk about, is your SI causing your back pain? And we're going to show you a simple finger. All you need is one finger, Brad, to determine whether or not you have sacro-iliac issues.
Oh, I was wondering about that SI.
Yeah.
Is an SI that they flip? It's like dyslexic.
That's right.
Anyways, carry on.
I don't know what you're talking about. But by the way, if you're new to our channel, please take a second to subscribe to us. We provide videos on how to stay healthy, fit, pain-free. We upload every day. And yes, you want to join us on our social media channels for 2 reasons. 3 reasons.
3.
We're going to give you positive vibes.
There you go.
2, if you want a shortened version of us where we don't gab on, go to Instagram and Twitter.
Yeah.
And 3, if you want to go join one of our giveaways,
Giveaway.
go to bobandbrad.com, go to the giveaway section. We're giving away the wall anchor again.
There you go.
That's our, I just want to flip over the.
It's on the wall. Can you imagine?
It's on the wall, and it's great for doing workouts. You can't beat it.
We call it wall fitness.
So, Brad, let's bring over to the spine here so we can do a little bit of anatomy lesson.
I'll bring
here.
over more than just the spine. We're going to bring over the whole Sam.
There we go.
There we
go.
Sam, he has been absent for a while, but always with us.
Yep.
Little
Nice
bald. Cutting. There
Let's
we go.
flip it around here. So we got here's your low back. So he's standing like this. And you have the sacrum, which is a triangle-shaped bone, basically, that's fused together.
Yep.
And you have the ilium on both sides, and they form a joint on both sides.
So typically, layperson calls this the pelvis.
Right.
Right.
And this is a weight-bearing joint.
Mhm.
It transfers the weights to the hips, doesn't it? The sacrum transfers to the hips.
Right, from the spine.
Right.
Mhm.
So there is a little bit of, it's controversial where there's movement there, right?
Right. I remember I went to a continuing ed course, and I said, "Yeah, there's movement there," and then another person says,
No, there's no movement there.
Yeah, there's no movement on that SI joint. Depends on who you're talking to.
So, when you have SI problems, the problem is, it may hurt right here.
Mm-hmm.
It may also hurt down the thigh
Sure,
a little bit.
yep.
It could go down the front of the leg.
Sure.
So it's kind of a difficult one. It can hurt when you're going upstairs.
Mm-hmm.
If you have a leg length discrepancy, one leg longer than the other, that certainly could result in this. The other thing is, if you have like arthritis or ankylosing spondylitis, very common with ankylosing spondylitis.
Sure. Mm-hmm.
And you're going to know what it is if you have it, obviously.
Right. And we're not going to take the time to explain it. Another way, if you walk off a curb that's higher than you expect, and all of a sudden a great amount of energy when your heel comes down, and it puts a lot of force up through the leg, and it can dislodge that, or
absolutely makes the ilium turn and
or shift
rotate.
it out of place a little.
Right. Another one is pregnancy.
Sure.
Very common. The hormones cause the ligaments to somewhat expand, right, or
loosen up, and and then because there's a lot of ligamentous tissue that support the SI joint, so that makes a lot of sense.
So we're trying to give you kind of some examples where the scenario where you might actually should consider that you have SI pain.
Sure.
But let's show you the simple finger test.
Okay.
So this is called Fortin's sign. Fortin.
I
believe that's how it's pronounced.
Is that a doctor?
Fortins, probably.
Yeah.
And basically, if you ask someone, where's your pain? And they go like this, and they point to a spot, and then you go like this, and you go, okay, show me again where your pain is. And they go right to the same spot. And if that spot tends to be, you can feel a bump. This is called the anterior superior iliac spine. You don't need to know that, but you can find it on most people.
Right. And
It's
this is one of those
bunion.
things, if you're not a therapist or someone who has practiced this, it can be a little difficult, but there's a bump there
Yeah, a
called
bump
the
there.
PSI.
So if you're a little bit below that, a little bit medial to that, you're going to be right in over the SI. So basically, what I'm going to say, Brad, is if you go and you point there, and then you point again on the same spot, there's a good chance you might have SI pain.
So that's how this study, or this Forkin sign, was actually studied. You asked the patient.
Fortin sign, yeah.
I'm sorry. You asked them with one finger, point to the
Right.
location.
And then the second time around, they pointed to almost the exact same
Sure.
location.
Okay.
So it's telling you that the pain is fairly localized
Right.
too. So this was the American Journal of Orthopedics. It was 1998. There's other studies, but they went to a clinic basically, and there was 54 patients,
Yep.
and out of those 54, 16 did this and pointed to one area.
More
They,
than once.
yeah.
Yep.
So then what they did with those 16 patients, this there's a reason I'm bringing this up.
Sure.
If you want to tell for sure whether or not you have SI problems, you have to go to the doctor and they have to actually inject it.
Right.
And they can inject it with an anesthetic.
Hmm.
And if they inject that joint and your pain goes away, that's a good sign
Right.
that it was a SI problem.
Right.
So
Unfortunately, that's not real practical or cheap to do.
no, it isn't. No. So there's diagnostic injections, which that was,
Yep.
and then there's therapeutic injections where they actually inject it with like a steroid to
Hmm.
see if it makes you feel better.
Sure.
But of those 16 patients, 16 felt better after doing that diagnostic. So in other words,
Mm.
16 of them did have SI pain.
Right.
So it was a fairly accurate test
Yeah.
to
Yep.
point. Now, Brad and I are going to show you a couple other ones just to maybe help you along. Brad, do you mind laying flat on your back?
Well, only if I can take a nap.
Yeah, well, we just did a video on that, didn't we?
Yeah. Um,
So
again, SI joint problems, I think overall in the therapy community and as well as physicians can be kind of a tough one to figure
it
out.
is, and that's why what I generally do, like if you one of these tests alone is not a good indicator,
Right.
but if you do like 3 of these tests and they all hurt, now we're getting pretty close that it probably is an SI
Right.
problem. So this one's a real simple test. All you do, it's called Faber's test. You cross over the ankle right above the opposite knee, and I'm going to grab the knee and I'm going to grab his pelvis right here.
Yeah.
And I'm just going to gently, this
Yeah.
is a gentle movement,
Right.
and I'm going to push on that. And if he feels some pain where he normally feels it,
Right.
like in the back or in the thigh, that's possibly that was an SI problem. So you can do it both sides. Of course, you could go to the other side and go ahead and give it a little press.
Yeah. And you really need to make sure the ankle goes above the kneecap because right there it was a little bit on my kneecap and it it's not comfortable. So just make sure.
And Brad's a baby, so
Yeah.
we're gonna make
Well,
sure.
I'm sensitive, Bob.
So
I'm very
the
sensitive.
next one, I'm going to show on the spine. You go ahead and lay on your side, Brad.
Left or right?
Why don't you face the wall
All
here,
right.
so we don't have to look at you. So you can see he's laying right like this. Now I'm
Why?
going to push right on the ilium or the pelvis,
I don't feel
and
anything.
that's going to gap the hair. So I'm pushing right on the pelvis here, right up on where it flares out here. And I'm going to push here just gently again. And does it bring on any SI pain?
And you're looking if it produces the same pain that the primary
Right,
complaint is.
exactly. If it hurts where I'm pushing, no, we're looking for pain here. A lot of people go, yeah, that hurts. And I go, where? Well, right where you're pushing. It's like, no, that's not the problem. So, all right, lay on your stomach, Brad, for the final one. So on the final one, I'm going to push right on the SI itself. So I'm going right up on the SI itself. I'm going to give a little pressure on there. And again, we're looking for the same thing here. Now, in this case, there might be a little bit of pain right where I'm pushing.
Yeah, it might
because
be inflamed.
Yeah, we're right on the SI itself. And this is a little bit of the test you could do. So if you do like, these 4 tests, the finger test and all the other ones I just showed you, and 2 or 3 of them are positive, it's a pretty good chance you have an SI problem.
Yeah. And just like this last test, if you're not familiar with the anatomy, which most people aren't if you're not a therapist or whatever, you may be pushing on the wrong spot or whatever. So maybe that might be a difficult one to do. But the figure 4 one is
It's
pretty
a simple one to do,
right.
fairly simple. Now, if one thing, I was going to show this, Brad. One thing, if a person's having SI pain when they're walking,
Yep.
and I do this with pregnant ladies and stuff like that, is I'll actually, if you can hold this just like that.
Well, we gotta get these femurs in
Yeah,
the right
femurs,
direction.
yeah. I'll actually, to simulate what it would be like to have a belt,
Sure, some pressure.
I'll actually push on both sides of the pelvis like this
Mhm.
and squeeze it together and walk along with them
Yeah,
and see if it feels better.
yeah.
So we got to do it, Brad.
All right, I'll do it.
So
I'll do it for the viewers.
so I'm pushing on here
Mhm.
while he walks. I'm squeezing my hands together, and if that feels a bit better,
Mhm.
then I'm gonna probably try a belt with him.
Yep, the SI belt.
SI belt.
Yeah.
And there's many times that simple test worked, and they did get some relief from it. Then
And we do have videos on SI belts. I think if you Google Bob and Brad SI belt, I think that would probably pull one of those specific videos up.
yeah, they have ones made for pregnant women.
Right.
So didn't you use one, Liz? Yeah,
Yeah.
Liz, our camera woman,
Sure.
used one at one time.
Yeah.
I don't know if it helped or not. Oh, she's
Oh,
giving a
there you
thumbs
go.
up.
Thumbs up. Say
All
no
right,
more.
so all right,
We could just. Are we done, Bob?
we're
Do you
done.
want to carry on?
I'm done.
We're gonna do it. You know, say it.
Yeah, we can fix just about anything
This thing.
except for a broken heart. Yeah, how did they do that? I don't
I
know.
think you go. Like
It's right
this.
up. I'll
How's
just put a
that?
real one
Does that
up
look
here.
good?
All right. Thanks for watching.